In this short video, we will provide an overview of the US healthcare system and how to seek medical treatment. The first step is what you do before you leave home. Healthcare checklist. Before you travel. Before you travel to the US, there are some simple things you can do that will make your life much easier and could prevent you from having to pay for things that are typically not covered under international student insurance plans. Visit a doctor. Go to your doctor and have a checkup before you travel and make sure all your vaccinations and immunization are up to date. If you are currently taking any prescription medication, make sure to bring a good supply with you, along with your doctor's notes for those medications. Before you leave your home country, it is a good idea to check what items are prohibited by the US Customs and Border Protection. You can check their website use the following link. Eye doctor. It's also a good idea to get an eye checkup before you travel and make sure you have current prescription glasses and contact lenses. Dentist. Make that visit to the dentist you have been putting off. Dental costs in the US can be very expensive, and sometimes only a portion of your costs will be covered by insurance. With some advanced planning and preparation, you can avoid a bit of healthcare expenses when you are abroad. I need to see a doctor. What do I do? When you get sick or injured, where do you seek care? The medical system in the US is made up of a mixture of many different types of providers. Large and small hospitals, emergency rooms, private doctors' offices, urgent care centers, walk-in clinics, specialists' offices, surgery centers, pharmacies, and our favorite, the on-campus student health center, otherwise known as University Health Services, UHS, or the town center. What options do I have? The best place to start, if at all possible, is the town center. Even if you waive out of the UC Berkeley Student Health Insurance Plan or SHIP, services at the town center are available at reduced cost or even free, are close and convenient, and even if you end up having to go somewhere else later, will save you some money. If you have SHIP, which is the case for most Berkeley students, then you also have access to a 24 hours, 7 days a week nurse helpline that you can always call for advice for free. Their number is 800-681-4065. Even if you do not have SHIP, you can call the town advice nurse at 510-643-7197. Urgent care clinics. In the event that a town center is closed, another more convenient option is a walk-in clinic or urgent care center. With long opening hours, no appointment required, and the ability to deal with a wide variety of medical issues, these retail providers have become extremely popular. They can cost a little bit more than a doctor's office, but much less than an emergency room. They typically accept a wide variety of insurance plans. For a list of urgent care centers near campus, please visit the website below. Local doctors' offices are another second good option, often called general practitioners or family doctors. These offices typically require an appointment, and some doctors may not accept new or short-term patients. Again, start with a town center and then visit a doctor's offices upon referral from one of the town center's licensed healthcare providers. Emergency room. The main thing to do is, if at all possible, stay out of the emergency room. Emergency rooms in the US are very expensive and are designed for life-threatening or very severe illness and injuries. If you have the flu or minor cut, you can go to the town center or an urgent care center for a fraction of the cost of the emergency room. Of course, for serious or life-threatening illness and injuries, go straight to the emergency room connected to your local hospital. They will be prepared to deal with any problem you have and will either treat you, release you, admit you, and refer you to another facility. You won't be cheap and you won't be quick, but you are in the right place for the serious case. A list of local hospitals can also be found on the website below. Pharmacist, a doctor at the town center, in an office, urgent care center, or hospital may write you a prescription for medication. In this case, you will need to go to a local pharmacy to get the prescription filled. The town center offers pharmacy services. Medical care in the US. How much does it cost and how to pay? The US healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The US healthcare system is also likely very different from the healthcare system you are used to back home. There is no universal access or national healthcare like many countries offer. When you seek any medical care, the providers you choose will look to you and your insurance carrier to get paid for their services. Like most Americans, you will need a private insurance plan. As a UC Berkeley student, the student health insurance plan mentioned earlier is already included in the university fees. With any type of insurance, including SHIP, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the US healthcare system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, co-insurance, or some combination of these items. Carefully review your insurance documentation so you understand how these payments work for your plan. The Student Health Insurance Office at the Town Center can answer questions about what these terms mean. To review, first, prepare before you travel. Second, know where to go when you are sick or injured. Last but not least, make sure you have insurance. And always remember, the town center is the first stop. Only visit an emergency room when you have a true emergency.